G'day and welcome back to the channel. My name's Grant Frost and I'm an Australian musculoskeletal physiotherapist who's really passionate about trying to better understand the root underlying causes of common aches, pains, injuries and dysfunctions, and also the best way to fix them. And in this video, we're turning our attention to patellofemoral joint pain syndrome, but we'll also give you the broader perspective needed to take that step back and understand why that specific part of your body has become sore in the first place. And before we sink our teeth into this, I just wanted to announce that I'm finally offering channel memberships, from which one of the benefits of being a member is access to extra exclusive content on each one of these topics. And for this video, as we go through some mobility and strength exercises, as a member, you'll have access to scalable versions of those exercises and different exercises to try, just to round out that rehab program a little bit more. So that being said, let's get into it. So in the spirit of trying to permanently fix your patellofemoral joint pain syndrome or maltracking patella or kneecap pain, the first step to doing so is understanding why it may be there in the first place. And for me, clinically as a physiotherapist, the number one thing that you need to take away from this video, above any and all exercises that I show you, is the concept that your knee pain is likely a consequence of something else. Your knee doesn't function in isolation on its own. It's just one part of the rest of your leg and is governed by your lower back. So as you'll see with the exercises that we'll get to, we definitely want to give you something to improve how your kneecap moves and functions to hopefully help your symptoms feel a little bit better. But if we also aren't going after your ankle flexibility and your hip mobility and strength, then we may be missing the bigger picture that has conspired against you to ask for the joint that's sandwiched in the middle of those structures to become dysfunctional over time. What we tend to see is that instead of your legs being nice and stable and moving in this linear plane, allowing your kneecap to slide smoothly and safely through the groove that it slides through when your knee bends and flexes, as soon as we introduce a foot that wants to turn out or a knee that wants to cave in, we're suddenly deorientating the angle that your knee bends and changing the direction of the line of pull of your kneecap. So in a nutshell, the goal is to try and permanently fix your patellofemoral joint pain syndrome must come with an attempt to smooth out your leg mechanics and in a way make squatting down as deep as you feel comfortable easier, more efficient and more optimal. So if you can keep that in the back of your mind as we go through each one of these exercises, it'll hopefully make perfect sense why we're doing the exercise that we're about to go through. And if you are a member, the additional exercises that we'll go through should also fit the mold of what we're trying to improve mechanically with your entire lower leg, not just your knee itself. And with all that in mind, the first exercise we want to explore is the banded ankle stretch. The reason why this banded ankle stretch can potentially be very helpful for you is that using a band around your ankle tends to buy some of those joint capsular restrictions that just aren't addressed by traditional calf muscle stretching. And how this looks is, again, we want to take the band that is secured to something strong, we want to place the band underneath the bumps at the base of your ankle, and we want to stretch that band out as far as you feel comfortable, keeping your heel on the ground. We're wanting to bend and flex that ankle to the end of your ankle range and oscillate in and out of that range to the best of your ability. Now, as we mentioned, we want to make sure that we're trying to re-optimize the basic function of your leg as a whole. And if you are someone who does tend to have your knee cave inwards or your foot turns outwards, which essentially creates the same inward motion of your knee, we want to make sure that we're not perpetuating that with this stretch. Because again, your body will not go through a restriction if you need to get past it. It's really good at going around a restriction, which is part of the problem that we're trying to solve here to improve how you're loading up that kneecap joint. So ideally, we want to have your foot straight with the band pulling directly behind you. And instead of just going as far as you can go, we want to make sure that your knee does come outwards without your big toe lifting up. And we want to go through wherever you feel is restricted in that ankle. Practice this for 30 seconds, 60 seconds, 2 minutes, and just try and go after some of those hidden ankle joint capsular restrictions that you may not have realized was actually there. And then once you've had enough of that, and you come out of that again, drop back down into the full depths of the squat, however that looks and feels for you. You should feel like that ankle suddenly feels a little bit lighter and a little bit looser than it did before, allowing you to cultivate those ideal mechanics a little bit better. And once you've started to work on some of those hidden ankle restrictions, the hip mobility that we're looking for is more of the hip rotational mobility that, when lacking, can again ask our knee to dump inwards to go around some of that restriction. And the rotation that we're going to go after is the one that allows us to keep our foot foot straight and rotate our knee out, trying to create a more stable linear platform for our knee to bend and flex from. Again, a really simple way to go after that hip external rotation is with a seated hip external rotation stretch. If this is too hard, you can definitely have your other leg down a little bit further just to decrease the rotational demands. But if you can get it up into this position, provided it doesn't annoy your knee, you're welcome to cradle your knee a little bit just to take some of the pressure out of it. But ultimately what we're looking for is we're trying to find some restricted tissue right in the heart of your butt cheek, about where your back pocket would be. And from here, we want you to be up nice and tall, again, cradling your knee if you need to. And instead of just bending forward as far as you feel comfortable, we want you to try and keep your back straight and just hinge forward through your hip. Just targets that hip that little bit more specifically. For me, I tell my patients to imagine that you're coming up and over your shin, just so you don't feel like you're running into it by bending your back. But again, up nice and tall, cradle your knee if you need to, up and over, lean forward, go looking for that tightness in the heart of your butt cheek. And from here, we want to get active. Wherever that feels tight, we want to try and tense that tightness up, either by actively squeezing your butt cheek or by pushing this leg down into the other one to make that tissue work. You want to hold it for 10 seconds. The idea being, again, is that when you stop tensing, that tissue will relax and physically give, which means that you should be able to go that little bit further into the stretch than you could before. And we want you to keep repeating that process of squeezing it for 10 seconds, relaxing, going further until you either stop making change or you get sick of the exercise. And then once you've performed this, we can then get you to stand up again and perform your squats again. And what you should find is it should be easier to keep your knees out as you squat down to the depth of your squat without feeling like your knee does want to jut inwards to compensate for that lack of hip external rotation. And once you've started to chip away at some of the broader mechanical restrictions that could be compromising the way that you load up your kneecap, the next thing we want to touch on is ways to strengthen those hip rotators as well, to give us a better opportunity to hold our legs out in a more stable shape and not let them dump in and change the way that you load up that kneecap as well. And one really simple way to improve the strength of your hip external rotators is just doing a very simple clam exercise. So if you can find a comfortable spot on a bed or the floor, lying down on your side, what we want you to do, keeping your heels together and your hips and knees bent up to about sort of 45 degrees. If you can find the side bump of your hip bone and come directly back from that and dig your fingers in there, this gives us great feedback to feel the correct muscles working. And from here, keeping your trunk relatively vertical, all we want you to do is keeping those heels together is just gently lift your top knee up as far as you feel comfortable, taking care that as the higher you go, you don't start to rotate your trunk backwards to change the demands of the hip exercise. So trying to keep your trunk stable, don't let it move, jamming those fingers in, heels together, open up your knee as far as you can before you feel like you start to compensate, and repeat this process for a set of 10 to 15. Digging your fingers in, you should feel the right muscles engage as you're doing this exercise. You should feel like they start to fatigue relatively quickly. If you feel it through the front of your hip a little bit too much, you may need to roll forward a fraction, which may cancel out some of that hip range that you had before. But again, it may help you better target the tissue at the back of that hip. We need to do enough of these that you feel some genuine fatigue, so your brain gets the memo that it isn't quite as good as it needs to be for this particular task. So with any specific problem, obviously the broader perspective is potentially really helpful to understand why the kneecap itself has become sore for you, but you still need to do something to try and get your specific symptoms under control so you can just do the things that you want to do while you're trying to get this better. And for me clinically, what I tend to see a lot is a lot of people tend to have a lot of tightness and tenderness through the outside of that thigh, potentially the ITB, the outer quad, and the surrounding tissue. And with this being tight, it creates this excessive pull on the outside of your knee, again potentially dragging that kneecap into the outside of your knee joints more easily and more consistently. And what I found over the years, a really great exercise that you can do at home to try and feed some slack back into that kneecap immediately is to take that same ball or lacrosse ball and start working through that part of your body. The simplest way to do this is if you're just sitting on the edge of a chair, you can place the ball in the outside of that leg, and you can go looking around for anything that feels tight, restricted, or uncomfortable. You can spend some time there, you can contract underneath that and relax to let it free up and give. But to just take that a step further, if you can again do this lying on a bed or on the floor, keeping the ball on the outside of that knee, we can gently let the ball press into that outside area and incorporate movement into this to make it free up faster. And once you're comfortable, we can get you just to roll onto the ball a little bit, and be careful because this can be quite tender for a lot of people, especially if your knee pain is quite sore at the moment. But put as much pressure through the ball as you feel happy to have your leg over the top, and that'll get you to bend and flex the leg underneath. Now I'll take the front leg away just so you can see here, but the idea is we want to find a spot that's important to you and just gently bend and flex that tissue through the ball, trying to keep that tension on the ball to try and shear any of that soft tissue free. Again, whether it's ITB, outer quad, fascia, whatever it is, if it's restricted, it's restricted. And then moving around, looking for the things that feel the most restricted for you can be a really great way to feed some immediate slack back into the outside of that knee and hopefully immediately improve how your symptoms feel. You can work your way up a little bit higher and continue to do the same thing. If it is a particularly tender spot for you, you can just pause at a certain spot, tense that tissue underneath, try and capture that muscular tissue. Then when you relax, it'll give a little bit, and then it may feel somewhat a little bit easier for you to do straight away. You can stand back up, and without falling into a hole, we can get you to squat down again just to see if it feels easier for you to move that knee with less of those symptoms attached. And then once you've done that, the second exercise that we can do is a really nice one to try and address some of the quadricep muscle tightness that might be impacting your kneecap immediately from above. And so the final exercise that we can start to look at to hopefully improve your immediate knee pain symptoms is a version of the couch stretch. And all we want to do here is we want to get your knee into the back corner of a wall or a chair if this is too difficult for you, and then getting your other leg up into this high position, keeping your back straight. We want to try and extend up from your hip as far as you feel comfortable, looking for any tightness down the front of your hip, down through the front of your thigh as it attaches into the kneecap from above. Now, if this is too challenging for you, we don't need you to come all the way up to start with. We definitely want you to get there eventually down the track. But if you can only get to here and you feel a lot of tightness here, it's perfectly fine. We just need to make sure that you can breathe comfortably here. If you can't talk, if you're holding your breath, if you're really tensed up, you will not be giving permission to your brain and nervous system to let this go. But as we do with any of the other muscular stretches, once you've found the version of this that feels the most appropriate for you, you want to squeeze that muscle tightness. Squeeze your butt cheek, tense up your thigh, push your foot back into the surface that it's up against, however that looks for you. Again, 5 to 10 seconds. When you give, it'll give. You should then be able to go a little bit further back into the stretch than you could before. Give it a squeeze again. Keep repeating that process until you've had enough or you've stopped making change. If it is too challenging for you, you're absolutely welcome to do this on a chair, and I would absolutely advise you to start there if you feel like this is too hard for you to begin with. It's worth noting that obviously if you have patellofemoral joint knee pain, putting your knee onto something may feel a little bit uncomfortable, but it's worth noting that the pressure is not directly on my kneecap, it's actually above the kneecap. So if you do have your knee a little bit too far away from the wall, then you will be putting more pressure down through the knee itself. We really do want to try and get it as wedged into the back of that corner as much as we feel comfortable. But if that's still too much for you symptomatically at the moment, then please put a cushion or a towel or something underneath that just to make it a little bit more comfortable for you. But at the end of the day, we absolutely want to pair up things that hopefully take away some of those immediate knee pain symptoms with things that will hopefully address the underlying cause of why those symptoms were there in the first place. And as I'm trying to promote quite heavily with these permanently fixed videos, that principle of pairing up the symptomatic treatment with the broader perspective is missed so much, mainly because you need to go looking for that broader perspective to find what you need to be working on to improve the entirety of your leg mechanics, not just how your knee feels and functions. And with all that being said, I genuinely hope that those exercises were helpful. If this video resonated with you, please consider leaving a like on the video, subscribe to the channel if you want more of this type of content from me. Please consider becoming a member if you want more exclusive content. But as always, thank you again for watching, and I hope to see you next time. Bye.